Hi, everyone. I'd like to thank you for joining the Green Party of Ontario's first platform town hall, A More Caring Ontario. Tonight, we'll be focusing on health and mental health. So good evening to everyone and welcome. My name is Sean Yo, and I'll be your moderator this evening. For the best experience, we recommend you keep Zoom on speaker view, and if you like, you can turn on closed captions. We have a live captioner who will be captioning our event tonight. Also, please note that this town hall is being recorded. Before we begin, I'd like to start with a land acknowledgement. As we open this space in our time together tonight, I invite you to join me in acknowledging that we meet on the traditional territory and unceded Indigenous lands here and across Ontario. Land acknowledgements are a practice that I've been able to participate in for many years now, and that's something I'm very grateful for. I believe that we walk together along the path of reconciliation, and that means that we aren't standing still. This means how we acknowledge the land cannot stand still either. Land acknowledgements are not a box to be checked, a to-do to be crossed off, or a video to be played at the beginning of a meeting. They must be personal, authentic, real, and living. Tonight, I join you from land which was part of the Between the Lakes Purchase Treaty, which is the treaty which involves all the places I live, work, and play. I've read this treaty, and I encourage you to find your treaty and read it as well. All of us live on land which has a treaty which has been agreed to and is yet to be honored. And these are the places that we all live, work, and play. One place you can start this learning is on the ontario.ca website, and you'll find a link in the chat. I believe if all Canadians spent the time to read these treaties, or even just the one where we live, we'd be making a meaningful next step in reconciliation, which would help us continue this journey together. And so from the traditional territories and unceded lands of the Anishinaabe, Haudenosaunee, and the Attawandaron, and which is the current territory of the Mississaugas of the Credit First Nation, I invite you to reflect on the fact that this is dish with one spoon territory, and that we've all agreed that this land is a shared bowl and there's one spoon for all of us, and that we must ensure that the shared bowl is never empty, keeping in mind social distancing practices during these difficult times. As we work towards a better future for all people of Canada, between communities, between provinces, and between nations, we acknowledge that the importance of bringing Indigenous teachings, such as the principle of 7 generations, to our leadership and governance. This is the principle that as we live our lives and build our communities, we must ensure we're planning not only for today, not only for tomorrow, but for the next 7 generations in terms of the land, all of our people, and their health, physical and mental. And so with that, I'd like to make sure that we all know why we've come together today. And tonight's event is about understanding your concerns about health and mental health and getting your feedback to help us inform the Green Party of Ontario's platform. I'd like to take this opportunity to give a good shout out to the GPO's platform co-chairs, my good friends, Stancy Dankert and Abhijit Mane. They'll be listening carefully to the feedback we receive from participants at all of our town hall series this month, including tonight. We have a great panel this evening, and we also have a question and answer session later on where we'll take questions from you. Before we get started, I just want to go over what we can expect in the town hall and some house rules. We ask that everyone remain on mute and only unmute when you are speaking or called upon. For that purpose, please ensure you have your correct name displayed. We'll be using the polling feature on Zoom tonight to help guide our discussion. When prompted, please complete the poll if that's something you'd like to participate in. We'll be using the raise hand function when Mike Schreiner asks the audience a question. And during the open question and answer portion, please type your questions into the chat window, and we'll do our best to pick a variety. Those calling into the town hall on a phone won't have those features, unfortunately, but we will do our best to include you as time allows. Tonight's town hall, we are committed to making this safe space for all of our guest speakers and participants. With that in mind, our equity officer is online today, Ran Zhu, and you can reach Ran by messaging him directly on the chat function, or you can email equity@gpo.ca. I'd like to be very clear that as part of our event tonight and part of making this space as safe as we can, we will not tolerate hate. abusive or discriminatory language, or any harassment of any kind. We ask that everyone participate with respect for one another and in the spirit of community. Okay, those are the rules. So now we can get to the fun stuff of listening to you and finding out what's important to you. But before I pass the spotlight on to our speakers, I want to kick things off with our very first poll. So we can get that started right now. And the question is, when you think about mental health and healthcare in Ontario today, what are the top 3 issues that worry you? So you should see that poll on your screen right now. You can click up to 3 boxes and then just click submit, and then we'll go over those results. And I am going to fill this out the same. All right, I'm done. To be fair, I saw the answers ahead of time, so I might have gone a little bit faster. Don't feel rushed by me. So this is a great opportunity for us to practice a little bit with what these polls are going to be like. And we'll be doing some more of these as part of our town hall throughout the next hour. So I'm going to see if we have those results ready to share on screen. We'll just give people another moment. It's so great to see so many people here tonight. Here we go. So by a pretty decent margin, actually very close, 57% long wait times for counseling, mental health support, 55% not enough funding for healthcare. I'll let you guys take a look at those results and review them as I turn the spotlight over to Mike Schreiner, leader of the Green Party of Ontario and MPP of the Royal City of Guelph. He will now join us to introduce our special guests and discuss reactions to our first poll. Hi, Mike. How's it going?
Hey, Sean. Thank you so much. Good to see you. And I just want to thank everyone for joining us tonight. It's so important to hear your feedback. And I'm just really excited to have 2 special guests who are experts in the topic we're talking about tonight. And I'm going to give very short introductions given the time. So Camille is the CEO of the Canadian Mental Health Association. She's been in that role since 2012. And I just want to say CMHA's mission is it works to achieve its mission by being a leader in the evolution of Ontario's mental health and addiction system. And our other special guest tonight is Adrienne Spafford, who is the CEO of Addictions Mental Health Ontario, and she's been in that role since 2018 and actually worked in the Premier's office as a policy director prior to that. And AMHO's mission is to lead change that will revolutionize the addiction and mental health care experience for people in Ontario. So I can tell you from the many meetings I've had with both of our guests tonight that we certainly have 2 experts in the field and 2 people who deeply, deeply care about the issue we're talking about tonight, which is appropriate, I think, because this week is Mental Health Week. And so I think it's appropriate we're launching our first town hall on how do we create a more caring Ontario tonight. And I think one of the things that's so important about tonight's conversation is that when I think of developing policies and platforms and what we can advocate for at Queen's Park, I always think about consulting with experts, and we certainly have 2 of the foremost experts in the province with us tonight, but also consulting with people and really experiencing and hearing from and learning from people's day-to-day experiences, your concerns, your fears, your hopes, your dreams, and intersecting that with expert policy advice to develop something that really works for everyone in Ontario. And I would say I'll give the first reaction to the poll question, then I'm going to turn it over to you, Camille and Adrienne. So my first reaction was that we're not investing enough in caring for people. And I think it's one of the things the COVID pandemic has really highlighted is just the inequities in our system and the gaps in our system, whether it's accessing care for physical health or mental health. And I was just thinking of how many calls come into my office, people who are struggling to be able to afford access to healthcare, mental health and addiction support services, and how many people, not only are they having to wait too long to access that care, but in many cases are struggling to figure out ways to afford that care. And I think tonight's poll results certainly reflect that. So I'm wondering if, Camille, do you want to share your reflections on the poll results?
Well, I'd be happy to, and I want to just say thank you, Mike, for this kind invitation, and thank you to all of you who have joined in. I'm very much looking forward to the conversation tonight, and I'm really happy to be part of this during Mental Health Week. The poll, frankly, wasn't surprising to me, to be honest, and I think we continually hear about the fact that people can't get the service they need. And you referenced that in your comments, Mike. This has been an area of healthcare that has been chronically underfunded, and it shows. And the pandemic has really reinforced the gaps across the healthcare system, but most acutely in mental health and addictions care. And I think we haven't seen the worst yet, because I think people are really struggling. This week, the Canadian Mental Health Association National Office released a poll. So nationwide, 77% of Canadians say that their mental health has been very impacted by the pandemic, and they're not feeling mentally healthy. So that number should be concerning for all of us, and particularly those of us who work in this sector, because we know what's ahead of us, which is we really need to ramp up our capacity and our services so that we can respond and get people mentally healthy, so that we can go back to the lives we knew and restart the economy and do it in a much more mentally healthy way. So I completely concur with your comment about lack of funding, and that's something that Adrienne and I work very hard on every day to try to bring capacity and resources to this sector.
Thanks for that, Camille. And Adrienne, I was going to ask you to reflect on the poll results.
Yeah, well, thanks first of all, Mike, for having me here. Real pleasure to be here with Camille, who's such a phenomenal colleague in this space. And thanks also to everyone who's watching and everyone who's organized. Like Camille, sadly, the poll results were not surprising. And it's an area where the general public and the participants today and the experts are exactly on the same page. Wait times are too long for services, and it's hard enough because of stigma for people with mental illness, people struggling with their mental well-being, people with addiction, or people who use drugs, to ask for support. And we need support to be there when they're ready to put their hand up and make that request. I thought actually just as interestingly was the third response to that answer. So the first response was wait times, the second was not enough funding, completely agree with that. And the third was that therapy is too expensive. And I think that shines a light on how we still think about mental health and addiction differently, because we would never wonder if cancer treatment was too expensive in this province or in this country, because we've got a commitment to universal accessibility for that condition, and we need to get there for mental health and addiction.
Yeah, thank you both for those reflections. And before we go to audience questions, I have a few questions I want to ask, if I could take that prerogative. And the first one is we know that COVID's had a significant impact on everyone's mental health, but I think especially the mental health of young people. I just think of time outside of school and just disruptions and routines and day-to-day life. And I know that access to mental health services pre-pandemic, the wait lists for youth were particularly long. I believe there was like 28,000 young people on the wait list. The wait list was up to 18 months. But if I could personalize it, I'll just never forget one afternoon. I was in the last provincial campaign, actually. I was Main Streeting with members of my team, and I was at the corner of Wyndham and Macdonell in Guelph. And a young person came up to me, and I said to him, "Oh, I'm Mike Schreiner. I'm running the BNPP. How are you doing?" And he looked at me and he said, I'm doing better today because a mental health crisis worker reached out to me last night. But it would have been helpful 16 months ago when I was on suicide watch. And luckily I've survived, and thankfully I've helped today. But if you get elected, will you do something for people like me? And that experience has always stayed with me. So Adrienne, do you want to maybe think about youth mental health and how we can improve mental health services for young people? Oh, you're on mute. Our COVID world.
Thank you. That's going to be the most popular sentence of 2021, I think. You know, when it comes to children and youth, I think that it's even more important to get access to care quicker because their brains are still developing, right? Like there's real opportunity to have a lifetime worth of intervention if you can get services to kids and youth faster. And the wait times for services, particularly at the more intensive end, like we're talking those wait times that are 2 years, are for kids who are having suicidal ideation, who are thinking about ending their lives, who are self-harming. And COVID has had a real impact. We know that eating disorders have gone up. We know that suicide ideation has also gone up. Dr. Staney Brown, in his reports from the Science Table, has spoken about eating disorders. And youth are also struggling with addiction. You know, we talk a lot about mental health with kids. We've also got a lot of kids who are suffering with addiction, and the wait times for that treatment is just as bad. So what can we do? I think we need to always, when we're talking about kids and youth, we do need to think about the family unit. We do need to think about what's the environment. So we need to get them access to treatment. We need to be thinking about what can we do for the family as a whole. And there's great models of the whole community becoming supporters of mental well-being and sort of psychological safety. There's a model called Thrive out of New York City that's a great model that would be so great to replicate here across Ontario if we were to see mental health and addiction really become a priority for a government.
Thanks for that, Camille.
Yeah, I would simply say that one of the distinct opportunities, if we could think of it that way, is that generation, the generation of young people today, will actually change the face of mental health and addictions. They think of it very differently. They're more proactive about it. There's less stigma around it. I'm not suggesting there isn't any, because certainly there is, but there's a much more of a comfort level than, for example, when I was that age or any of us was that age. So I do think they can be game changers, but what's really needed, and I would argue the same is true across the mental health and addiction system, is a robust ability to serve these young people. And that doesn't exist today. And yesterday was a great example, not to get too political early on, but I actually spent 8 years working at Children's Mental Health Ontario. And that was back in the day before people really thought of children and young people as having mental health and addictions issues. And our colleague, Kim Moran, who's an extraordinary leader and is currently CEO of Children's Mental Health Ontario, has spent the last 24 hours saying to the provincial government that their announcement yesterday, which was well intended to put more resources into the sector, actually disadvantages the community-based sector where these children and youth should be served. Because by putting the resources outside of it, it essentially starts to then create cracks within the sector and less of an ability to navigate to get service. So having planning tables, having conversations around how we can have a more robust system locally, how all partners have a role in that, including primary care, is so critical right now. We're never going to tackle that 28,000 person wait list. unless we can really start to organize a more robust system at the community level.
Wow, that's a good point, and I think really highlights for me how important it is to make sure the right people are at the table when decisions are being made, for sure. You know, one of the things that, building on that, that COVID's really highlighted for me is just the systemic inequities in a lot of our systems, and in particular, the systemic barriers that Black, Indigenous, people of color face, the systemic barriers people who are lower wage workers face in accessing care. And so as the two of you think about, and I'll start with you this time, Camille, what are the biggest challenges people face in accessing mental health care, and how can we overcome those challenges?
Well, I would start by saying, first of all, it's difficult for people to navigate. It's difficult to know where to access services. So we have a lot of work to do on that front. And again, it's not any one party that's responsible for that. It's many parties responsible for trying to have a better system of care. And I would say the new Center of Excellence on Mental Health and Addictions, which is part of Ontario Health. Some of us have read and heard about these healthcare structural changes, is going to help on that front over the long term. So that's a positive. So navigation capacity, frankly, is, and we've talked about this, without question, there is just not enough capacity across all parts of the system. And by that, I mean mild to moderate issues, much more serious issues. And as a result, people aren't getting timely care. And that is problematic in and of itself, because inevitably people potentially become sicker. And the example you used, Mike, and the fact that it stays with you 4 years later is really quite telling. That young person came to you and said, I needed the care a year ago or 16 months ago when I was truly critically ill and wasn't getting it. So I would say that those are two significant pieces.
Great, thank you. Adrienne?
I would completely agree that navigation and capacity wait times to services are a real challenge. You know, I'll speak to navigation from a personal experience, and then want to get back to where you started with this question. Mike, my father passed away from schizophrenia about 4 years ago now, 5 years ago now. And as a young, relatively young adult who was his caregiver, to try to access care and support and services for him was almost impossible. And a big part of that had to do with, I think, stigma. His family doctor wouldn't talk to me, and there was not connection with family after a hospital stay, because he was picked up by police. And he died soon after that hospital stay. And when I think about the amount of time and energy and research that I put into trying to get him support, and the outcome, which was a really untimely, undignified death in a province like Ontario and a country like Canada, it really is just unacceptable. And that was 5 years ago. You know, I think 10 years before that, it would have been just as bad. And sadly, and this is why I get up every day, it's not much better today, really, than it was 5 years ago. And like Camille said, it frustrates. That's the fire under my belly, because it's imminently fixable. We've done this work in other parts of the healthcare sector. We've done the organization and the navigation and the establishment of standards in our cancer care system. We've done it in our renal care system, and we've done it in our cardiac system. And if we could if we could have as much care about people living with persistent mental illness who are getting sick on wait lists and dying because of it, we would have so much better outcomes for those people, for their families, for the economy, and for communities ultimately. But I do think it's important to speak about how, like, that was my experience as someone whose background is a white settler background. I can't imagine what that is like for a new immigrant to Canada. I can't imagine what that is like for someone whose first language is not English and who are struggling to understand literature, let alone trying to have an interaction with the healthcare system and providers who often look similar to me, and would have looked like my dad did. And I think that it's really, really important in mental health and addiction that we're also looking at how behaviors related to mental illness and addiction have historically been criminalized, and that we're looking at making policy changes that would decriminalize those behaviors, because that aspect of criminalization also has roots in racism and is only going to make outcomes worse for Black people and Indigenous peoples and people of color.
Thanks for sharing, and I'm sorry for your loss, and understand why you're so passionate about this issue. It's very personal. So I'm going to shift to asking all of you in the audience a question, and I think Sean's going to help me with this, because I may not be the most tech savvy person on the Zoom tonight. But the question is, in the world that all of you want, what do mental health supports look like for you and your community?
Thanks so much, Mike. So this is an opportunity for you to raise your hand using the Zoom feature. You can just find that under reactions and click the raise hand button, and I'll be able to see that you've done that. And this would be a chance for you to have your camera on and unmute to ask that question of our panel. Also, I want to make sure you know that you'll have an opportunity to ask questions just in the text chat. So if you're feeling a bit shy, this isn't the only way that you can ask a question. And we'll take a look for people who have a raised hand for a question. And so I'm going to start off with Lorna. Lorna, thank you for turning on your camera and being so brave as the first other first person to ask a question. So I see you're off mute. Please go ahead and ask your question.
Well, I was going to kind of give an answer. I was wondering, were you actually asking a question, or were you asking us to tell what we picture a good mental health system to look like, health system?
I think providing a short answer is great. So go for it, Lorna.
Okay. Yeah, short, but not the only answer, obviously, or just an idea that popped in my head as you were asking that question is, I mean, for me, as somebody who has has had mental health challenges, somebody in the health system to walk with us. I have experience with facilitation, and a facilitator kind of model strikes me as something that would lend well into this mental health thing. So it could be, I know about, I don't have the right terms, I'm sorry, for a community facilitator who walks with the person who's struggling with the mental health challenges to help them navigate, to help them to be a sounding board, to be somebody that they call, who helps them connect with their doctor or with services out in the community, who advocates for, free services where income is a challenge. That kind of a navigator, facilitator role, I don't think it exists consistently, if at all, in our community. I've seen bits of it. I have a mom who had mental health challenges and had some wonderful people that, like a one-on-one person who walked with her in the community at different points in her life. But again, I think that's only sporadic and hit or miss in Ontario. I'll stop there.
I'd invite any of our panelists to respond to that.
So it sounds like you're describing peer support. Does that sound about right? Yeah.
I just want to say, not necessarily just peer support. It needs to. It could. Yeah.
With some navigation.
Yeah.
So right. So yeah, extremely critical to the ability to have recovery without question. And an extremely important part of, I would say, the governance of community-based systems, where peer support individuals participate in decision-making within organizations. So they bring that lived experience into the culture of organizations to help understand and help ensure a smoother journey for the clients that are served. And in board decisions, board members are often have peer support background. In fact, just last night, we hosted a session around peer support. So I will defer to Adrienne if she has anything further on that.
No, I think peer support is so important, and we've had real success with community-based peer support workers being embedded on hospital inpatient units to help with the transition back to community. I think the point about navigation and having navigators is really interesting. And I think, again, you'll hear me go back to other healthcare conditions we talk about as medical. If you get a cancer diagnosis, you get a navigator. I remember my mom's a 2-time breast cancer survivor, so I have a real, I often draw parallels between the two very different experiences. And at her appointment, the first next step after receiving the diagnosis was a meeting with a registered nurse who was a navigator and helped her through the different aspects of the journey. And I think if we want to improve people's experience as well as outcomes, help them stay healthy, then that support to help navigate through a system and make sure they're not falling through the cracks is so important. I think it's a great idea.
And just if I could add one thing, there's an extraordinary woman that both Adrienne and I know named Betty Lou Christie. And Betty Lou is with Support House's Center for Innovation and Peer Support, which is an extraordinary organization that helps train people to understand this important component of care. And she's also the Minister of Health's Patient and Family Advisory Council chair. So she actually has the ear of the minister to talk about how the healthcare system has to engage families and engage people with lived experience. So if you are interested in that, again, it's the Center for Innovation and Peer Support. And I think if you Googled it, you could learn an awful lot more about their important work.
Thanks, Camille and Adrienne. I really appreciate those thoughtful responses. I'll let people know that there's a lively conversation happening in chat as well. But next up, I invite Tracy to unmute and ask your question. Tracy, thanks so much.
Hi there. I was going to make a little more comment just to follow on what Lorna said. So I'm working with some people in Nova Scotia, Bridgewater, Nova Scotia. They're working on a program on, it's actually about energy poverty. But one of the key parts about that is they're looking at entry points to the system. So when somebody calls up because they're looking for food bank services, for example, because it may be a single mom who's struggling, they get in the system by being assigned a navigator, as we were talking, but then they're also prompted to, are there any other services that they could use? And that navigator will help them navigate other systems and other services that they may not actually know how to do themselves. So it's the concept of doing some, I'm going to say, support beyond the purpose that the person's initial need is, and how do we maybe perhaps prevent or get ahead of some of the systems and services that they may need before they're in a two-year waiting list or whatever. So that's just something that this is something that we may learn from as they roll out that system.
There's a lot of innovative things happening in Nova Scotia. So I know this from my colleague who's my counterpart there. So thank you for that. I will follow up with her.
There has also been some great innovations out of COVID-19. It's important, I think we're looking for the silver linings. And in particular, there's been some amazing work I don't like to pick favorites, but there's been some great work done in the Ottawa area with a new platform called Connected Connected Care, sorry. And it's a digital platform where 22 local community agencies have come together. I'm so sorry, this is COVID-19. Just give me 1 sec, okay, Sam? And then I'll help. You want to say hi? This is my son, Sam. He is 3.
Hi, Sam.
Sorry about that. Sorry about that, everyone. Okay, so back to Ottawa and Connected Care. They built one platform and 22 local community agencies have come together, and they now have one virtual door where everyone in Ottawa can go, and within 24 hours, you can book one single sessional appointment. All of the organizations have pooled their resources to be able to provide one single session. And they're finding that 40% of people are okay with just that one session and don't need to go on wait list for more services. And so, I think the more that we are having that natural connection and building the benefit of those digital innovations that have come to be, that would be a great example to scale up provincially from my perspective. Particularly if we're going to keep going with Ontario health teams, it would make sense to me that each Ontario health team would have some sort of platform like that.
I agree. I see Eric's hand up, but at some point I'm going to want to jump in and talk about one program that might really help everyone.
Go ahead, Camille, go ahead. Go ahead. Eric, I see your hand and I'll call on you shortly, okay?
So the province is currently implementing what's called structured psychotherapy, which is going to help people who have mild to moderate mental health issues. And they're in the process of putting the infrastructure to it together, and it will be delivered on a few different platforms, but with some bias, which I will freely admit. There is one program that's been available for some time called Bounce Back. And Bounce Back is a coaching program provided over the phone. And it's run by my organization, and there's a call center based in York Region, which serves the entire province. And the way it works is if you feel that you need help, counseling, support, it's available to everyone, 15 years and up. It is entirely free, paid for by the province of Ontario. And what you do is you go online to bounceback.ca, and you refer yourself basically, and you have to give the name of your primary care provider. Within 48 hours, you'll get a call back and you will have an assessment, and that will ensure that you're appropriate for the program. But it will also trigger the start of the program, which essentially means there will be some determination of what it is you need help with, and when you would like to seek that help. So it's entirely personally driven, and it is you have the ability to go on and book your appointments yourself online. It's available in 17 languages, and there are 20 different workbooks for different topics that you can get help with. So it is entirely coaching. It's not counseling. I just really want to make that clear, because for some, and I see Lorna's comment, absolutely true. So the assessment will determine if it's appropriate for your level of need. So if that's at all helpful, it's bounceback.ca.
Thanks so much, Camille. And I also would like to extend a special thank you to young Sam for bringing some spontaneous joy to our time together tonight. And I'd like to hand things over to Eric to ask his question.
Actually, it's not a question. And going back to the original question, which I believe was something to the effect of where I would like to see the mental health support go, or where I'd like to see mental health in Ontario. I had an experience, a relative of mine ended up homeless a few years ago. And the reason I bring it up is because both Tracy and Lorna touched on navigation through the system. And there's absolutely zero chance that he would have been able to find his way through any kind of system if I hadn't been there. And I'm no big hero. It just happened to be one of the only people that he ever contacted. He would contact me twice a year, on my birthday and just before Christmas. And and he called up and said that he'd just been kicked out of his apartment. So somebody who'd held a job forever, couldn't really live on his own. So when his mom died, he was, but he held a job up until he developed some physical problems, but he had mental health problems all the way through. So the physical problem triggered it, ended up, didn't show up at work, didn't do anything, ended up out on the street. He had no ID, didn't have a phone. He would go to a phone booth to phone me. Didn't have a phone, didn't have a health card, didn't have a doctor, nothing. And I didn't have any experience, very little experience with the social services and stuff. And it was such an effort to try to find the help that he needed. I found it all. Could find my way through. There was no continuity. We saw a social worker who was really, really nice, got him on emergency welfare, which couldn't possibly be enough to live on if he hadn't moved in with us. Then the next time, and he connected with her. Of course, they have a different social worker next time he goes. But anyway, I guess my point is navigating through that system. For people like that, Camille was talking about some of the services you got there and the digital services to connect with these things. There's absolutely no way this person would have been able to do that the same way as all the other people that are out on the street. That, not all of them, because some outreach workers, really good people, find these people, but it's not there. And that's the point I'm making. Is so in terms of what I would like to see in the future in terms of mental health support is somebody that would guide somebody like him all the way through the whole system, not just the mental health part. That was just one factor in all of this. Serious physical problems, not making a lot of money, lots of stuff, right? I will leave it at that, but that's what I would like to see. And I don't know what the solution is. It'd be really nice if between us or somebody, I don't care who, bring in whoever we need, but we need to help people like that. He was just lucky that he happened to have people around that happened to know him and bring him into it. A lot of people don't.
Thank you, Eric. I see some strong support from some vigorous head nods from young Sam. We need to wrap up this part. We will be doing more questions in chat. So what I'm going to do is I'm going to invite Emma to turn on her camera and unmute, and you can ask your question, and we'll wrap up this part of our town hall tonight with Emma's question or comment.
Hi. Yeah, I wanted to add something to the conversation that I think if we're talking about mental health care in Ontario, you need to think of the most vulnerable people. So for instance, like having virtual care or like digital care, I think you have to keep in mind the digital divide that is happening. I think also like having like a one-door service is not always the best. Like we have here 24/7 in Guelph. And in my experience, like as a service provider, it's not good for especially the most marginalized people. I think also what I've noticed is that mental health care is often very siloed. You have addictions, you have sexual violence, you have, whatever, it's very siloed. And sometimes people will say, well, sorry, we do that, we're not going to do this. And then somebody has to go through the whole process again. So anyway, I think mental health care in Ontario is fine if you have money or more privilege or more resources, like lots of people have been saying. But if you don't have those things, it's incredibly hard to access. And I also just wanted to pose a question, like, is there anything different, any other way that the province will support the mental health of those who are incarcerated, either in provincial or federal institutions? Because particularly like during COVID-19 and after COVID-19, I think like the mental health of people who are incarcerated needs to be addressed. So just a question.
I'm going to invite Camille and Adrienne to provide a brief response, as we do need to move on to the next section, but I think it's a really important question. I'd love to hear your thoughts.
I just want to make, sorry, go ahead. No, go ahead, Adrienne. It's okay.
Very briefly, I I think you raise a very, very important point. And if anyone wants to hear my answer at length to this, I was on the Hurley Burley podcast, and I go on at length about this. But my view is that's why it's so important we treat mental illness like a physical healthcare condition. We wouldn't imagine looking at cancer and only building up services for people of stage 1 cancer. We would need to build up services for people at stage 4 cancer as well. And I think that until we are looking at building a program that's ultimately going to reduce premature death because of mental illness and really going to tackle that outcome, we're going to keep coming up with policies that work well at the door when politicians are door knocking during campaign time. You know, we need to be building a mental health and addiction care system that goes beyond political and government mandates and really keeps getting better for decades to come.
And could I just give 30 seconds on, I really just want to recognize, because we didn't respond to Eric's story about his family member. And I just want to say that, Eric, that is not an uncommon story in the complexity of the person you described and the various care needs that they have. And it really underscores how challenging this is and how much work we have to do to improve the system, because there are so many component parts to the person you described. And you're quite right, there's not one door that solves that issue or one perfect program. So case management, where there is someone assigned from an organization to assist that person, is a step in that direction. But again, it is complicated through the homelessness you described, etc. So I just wanted to recognize and frankly somewhat commiserate with what you described and express my sympathies, because I think you've really nailed the crux of where we're at and why it's such a challenge right now.
Just a very quick response, because I saw him about an hour ago. He's actually in managed to get into a group home not far from here. And it's actually, he's got really serious problems right now, physical problems. He's in the right place, but it was not a quick process to get him there, but he's in just the right place. He's way happier. At least the mental health issues are dealt with. His physical needs are dealt with. So there are places there, there's not enough of it. And
there's not enough. There's not enough supportive housing. And Sean, I know you want to move on, but I'm just going to say, it won't surprise you to know that my phone rings routinely with people that I know, just people in your world who are looking for help for someone else, a family member, a loved one, a friend. And sometimes questions come at me and people say, I need this for my brother-in-law, or fill in the blank. And those are the times when I cringe, because as long as I've been in this business, it is so hard to be able to pinpoint exactly how to help that person in the moment, and to help the person who's calling me. So we're faced with that routinely too, in various ways. And basic income, I absolutely think is critical, and we have a national position on that. So I'll stop.
Thank you so much. Hey, I really appreciate the passion and the authenticity and the very personal sharing. And it's not surprising to me that for these issues, and when the Green Party does outreach to invite the community, even a community as large as Ontario, that we have a really great conversation where there never seems to be enough time. So moving on, we're going to go to our Q&A portion of tonight's town hall, in terms of you guys being able to put your questions directly into the chat box. We also received questions and comments across our social media from all of the different channels and platforms that the Green Party of Ontario participates on. And we definitely wish we could have time for more of those questions, but we will have a few of them, and we'll start with one right now. Please feel free to put your questions into the chat box. People on our team are going to be looking at that and helping me select a good variety of those questions. And if you don't have a question, but you'd like to share your feedback, we're going to be putting a link to a survey in the chat box so that you can continue to have an opportunity to share your thinking, keeping in mind that a key goal tonight is, of course, connecting and having this conversation, but this is also very intentionally to inform platform and policy for the Green Party of Ontario. So this is an opportunity for you to share your voice and share what's important to you, so that that can be part of the consideration and the conversation that the Green Party of Ontario is having right now to help determine what we're going to be thinking about in the next election. So first, I'm going to start with a question from Jaden, who states that many people think that mental health or social workers should respond to every 911 call. So for our panel, what are your thoughts on this?
Forgive me, I'm multitasking right now.
That's
Can you just
okay.
repeat that?
Yeah,
I'm trying to read the chat, and
it's 2021, and Zoom fatigue is a real thing, and it's been a long day for us all.
Jaden asked, lack of focus. Sorry.
Jaden asked, many people think that mental health or social workers should respond to every 911 call. What are your thoughts on this?
Well, my thought on this is there are a couple of models that I'm familiar with at our branches across Ontario where we've seen a fair bit of success as it relates to people in crisis with a mental health or addiction issue. And the one that's I'll speak to is at CMHA Peel Dufferin in Mississauga, where they have really quite an extensive system of triage. So there's actually a crisis center built into our branch, and the calls come into the branch. There is a plainclothes police officer who is available, but the triage is to allow the exact right response to the call. So the intent is to make sure it isn't uniformed officers showing up, but rather, depending on the extent of the situation, that it is a social worker who has been heavily trained in de-escalation. And in addition to that, it might be someone else. And if it is a very serious situation, it's usually a plainclothes police officer who can assist that social worker or nurse in that call. So we've had really excellent results from this, including data that shows the vast majority of cases are resolved on the spot. And frankly, that means we're diverting people out of the emergency department where we don't want them. And they could be brought into our organization, which means that they begin their care and treatment and recovery in a community-based system, which is really the best resource for them in that state. So.
Could I quickly, I'm trying to be really quiet and listen, but I just wanted to give a quick shout out to Helen Fishburne at CMHA Wellington Waterloo, the impact team in our community where a mental health support person is going to respond to a lot of mental health calls is proving very successful and popular in our community. And I think, is steps towards addressing an issue that Adrienne brought up earlier is just not criminalizing mental health, and especially the disproportionate impact that has on people of color.
Absolutely, and I would say that I actually deliberately didn't talk about Helen because I think you're probably the most familiar with that one. So I thought I'm going to move somewhere close by and get to the same outcome. And frankly, for sad reasons, and the reason you just pointed out, I chose Peel because the truth of the matter is there have been in the last year and a half, far too many deaths that didn't need to happen. People who are racialized, who are mentally ill. And as we know, there have been a few instances where those deaths occurred at the hands of police. And we need to fix that. And I genuinely believe we can fix that. And I do think this is a model that could and should be scaled.
I'd just love to add, if we have time, very quickly, there's also models that I think are really interesting that are less a partnership between police and community, and that are really led by community there's a cahoots model in Oregon, for instance. And so I think the models that we've got in Ontario are definitely much better than what we had before. But I also think that we should be looking at crisis response models and this isn't about defunding, because I don't like to talk about, I believe we can do a lot of things as a province. We're a wealthy province, but I think that ultimately the accountability for response to a mental health crisis should fall with the healthcare system and not with the police system.
Thanks for that. I have another question here. If I'm not quite sure how this happened, it appears we have a question from young Sam saying, can mommy play now? No, I'm just joking. But more seriously, we have a question here. Where is the mental health support for adults with autism? There seems to be no psychologists capable of dealing with persons who have a communication disorder such as autism. And so this population is invariably given medication rather than any other kind of therapy. I'll also just mention that we're into the last few minutes of our time, so we can keep our comments brief. And a reminder that there's a link to that survey that Jessica posted if you have other things you want to share tonight. I'll hand things over to our panel.
I think that I was just on a socially distanced walk with a good friend who sits on the board of directors of Carey's Place, which is an organization that has housing for adults with autism that require basically 24/7 supports to survive. And she was talking about the challenges of keeping things open safely during COVID-19. I think going back to my earlier point about really wanting to focus supports and work and efforts on where things are the most complicated. He's cleaning my mess up, he told me. That this is another area, adults with autism, adults with acquired brain injuries, adults with complex, persistent substance use and addiction. Ultimately, it all comes down to wait lists. It comes down to training up very skilled clinicians and therapists who can work with challenging behaviors. That's a hard job, and it means compensating them accordingly and seeing that as a valuable job and as a valuable skill set in our system. And I think, like long-term care, we've seen that we as a society don't value caring for very, very difficult behaviors.
Hard to answer this one quickly. I concur. I would just say I actually started to scroll across to see if my nephew was on the call, and he asked that question because he actually is a teacher of children and youth with autism at the Toronto District School Board. And this is my weekend lobbying that I hear. So that question was really kind of the things he asks me about. And so it just a tremendous amount more that I think needs to be done here. And again, I'm conscious of the time, so happy to pick that up.
And I really appreciate trying to keep things on track, and we're doing really well. So thank you for that. And thank you for just the amazing conversation tonight. I'm going to just remind everyone on this call one more time that there's a link to a survey. Maybe Jessica post that one more time, just so it's at the bottom of the chat. And if there's something you wanted to share that we didn't have an opportunity to talk about, we'd really appreciate it if you took just a few minutes to share that with us. So thanks once again for the fantastic questions, the wonderful engagement. A particular thank you to Camille and Adrienne for joining us. Thank you to Mike, as always, for hosting these. I want to make sure we're all keeping in mind that there's several more of these virtual town halls that you can participate in. You just need to visit gpo.ca for more information. And one more time, we have that survey. We really want to hear from you. So if you take a few moments to share with us your priorities around health and mental health, we'd really appreciate that. We appreciate it. With that, I'll hand things over to Mike Schreiner to close things off for us tonight.
So first of all, I just want to thank you, Sean, for moderating, and Camille and Adrienne for your expertise and your insights. And I would say outside of tonight, just how I deeply appreciate that I know I can call on both of you if I have something I need to talk about in the legislature, or somebody's reaching out to me for information, that the two of you are such wonderful resources. And I deeply, deeply appreciate that. And I want to thank everyone who's joined us tonight. It's amazing how fast an hour goes and how much you can pack into an hour. And so I want to thank everyone who shared their personal stories and shared their ideas. I want to thank everyone who asked questions. And like Camille, I was distracted by the chat because there's so much wonderful information in the chat. And I just want Sam to know that my dog Helix has been at my feet the entire time. So I was happy that Sam could join us, but Helix didn't want to jump into the camera. So thank you, everyone. Be safe, be well, and really take care of yourselves as we all get through this pandemic together. So thank you, everyone.
Thank you.
Thank you.